Hi, my name is John Consalvi, and I'm here today with Dr. Van Mersbergen from Northern Illinois University. Miriam is not only a professor at Northern Illinois University, she's also a professionally trained singer. We're happy to have her here today to talk to us about voice. Miriam, thanks for coming out.
Thanks for having me.
Miriam, can you explain what a voice problem is?
A voice problem is a disruption in the pitch, the loudness, or the quality of one's voice that seems to impair their ability to communicate efficiently or effectively. It can also be a problem with the amount of effort one puts in voice production, or sometimes pain. Usually people consider it a problem if there's no other reason, like a cold, that surrounds it, and it has to last about 2 weeks before it's considered a long-standing problem.
Why do speech-language pathologists treat voice disorders?
So speech pathologists are trained in dealing with voice problems, specifically in how to hear and listen for a voice problem, and how to help individuals modify their voice if there's a problem. Speech pathologists also learn quite extensive background in the physiology and the anatomy of the voice to identify if there's something medically going wrong, as well as the behavior surrounding it. Most importantly, speech pathologists are trained in helping change particular vocal behaviors that might have precipitated the problem, or might help them get out of the problem.
If I have a problem with my voice, what should I do? Who should I go to see?
Well, typically, if you have a problem with your voice, you go to see your general primary physician. You explain to the physician that there's a problem, you're experiencing it, how long you're experiencing it. Most generally, what they'll end up doing is they'll send you to an ear, nose, and throat specialist. An ear, nose, and throat specialist who specializes in voice has a different name. It's called a laryngologist. I recommend that if you are having a voice problem, you go see somebody who has a primary interest and clinical expertise in voice. After you see the laryngologist, they will look at your voice, look at your vocal folds, see if there's anything that is medically wrong with your voice. Optimally, then you would see a speech-language pathologist who would look at how your vocal behaviors may be contributing to the problem. Ideally, you would see both the speech pathologist and the ear, nose, and throat specialist together to optimize your visit and maximize the communication between the professionals, so that you can see, so that you can have an understanding of what is the full range of the problem, both medically and behaviorally.
Well, Miriam, thanks for giving us the basics of voice disorders.
You're welcome.